turn to our next presenter, Indra Mondal. Indra is a PhD from the Arizona State University and an environmental engineer specializing in water technology and sustainable design. He focuses on wastewater-based epidemiology, microbial disinfection, and material toxicology. Indra has developed innovative frameworks for understanding human-environment interactions and their health impacts. He holds multiple degrees, including a PhD in environmental engineering from Arizona State University. He's committed to leveraging data science and modeling techniques to address critical public health challenges and create more sustainable built environments. So welcome, Indra. You know, it's been a pleasure working with you on research over these past 5 years now.
5 years.
You know, we're delighted to see the innovations that you have developed and how we can start to, going back to what we talked about with Dr. Tickner earlier, how we can start to utilize the data that's being reported in HPDs to help us better understand where are the areas of opportunity for improvement and also where maybe some of the most pressing issues to be addressed. And so with that, I will turn it over to you, Indra.
Thanks a lot, Wendy, for that great introduction. And thanks for the previous presenters for their awesome presentation. I hope I can do justice with mine. Now, without further ado, I'll jump on to the topic for this presentation. That is quantifying the presence of carcinogenic chemicals like formaldehyde in residential buildings, understanding their mass inventories that is embedded not only in specific buildings, but also say just the entire housing stock of the United States. And then understanding the human health effects that such exposure to such chemicals actually have on us. And finally, mentioning the healthcare costs that might be, that might emanate from a certain use of these chemicals if they are used unabated and going forward into the future. Now, skipping on to the next slide, the hypothesis that I had during the initial stages of this study was that formaldehyde is, since it's a widely used building material, it's probably will have a lot of effect on the population that are exposed to it, both the occupants and the manufacturing processes as well. Of course, the manufacturing processes have different requirements. The OSHA requirements are much different, but nonetheless, we expected there to be some kind of exposure to some kinds of exposure in every scenario. And after every long exposure, we expected there should be some kind of an effect that we would be able to measure. Now, just a brief background about formaldehyde in general and its use in the building materials industry as we know it. So as we can see here, the building materials industry was introduced to formaldehyde roughly around 1940s. And that's around 80 years from now. And it has been used pretty extensively, as we will see later on, in every industry going forward. Now, standing in 2006, that was the last measurable quantity that we could find in global production of formaldehyde. We had almost 32 million metric tons of formaldehyde that was produced in the world in 2016. Now, if we are to use measurements and assessments and modeling techniques to project as to how much we'd be using, that is close to around 60 million metric tons today as we stand. We'll get to that number shortly in the next slides, but I just want to give a brief intro on this. As you can see out here, it was classified as a group 1 human carcinogen. That means it's basically a known human carcinogen. That's like there is abundant evidence to support the fact that exposure to it will actually cause cancer in humans. Now, moving to the next part of the study. So formaldehyde is present in the buildings, of course. Now, why should we care? The first part, as per the EPA, is that we spend around 90% of our lifetime indoors. That's quite a long time. Now, if the average life being around 70 years, if we spend 90% of our lifetime in indoor environments, that's 63 years for an average person. And that is a lot of years. The next thing is it's a known human carcinogen, as we discussed. So in the year 2004, as we discussed, IARC, which is the international classifying body for human carcinogens and cancer research in general, had classified this as a human carcinogen way back in 2004, and it's still being used after 20 years of that discovery. Now, the next thing. So in toxicology, there is a saying that of course, if a chemical is there, it's there, but do we get exposed to it? Is what we really need to concern ourselves about. Now, from empirical studies and from researches that has been performed, for many, many years for now, as we discovered in our literature review, was that there's a lot of off-gassing, there's a lot of potential for off-gassing of formaldehyde if it's it's an active ingredient in the products. Now, we'll get to the portions as to where and how formaldehyde might be embedded in products. But in general, the risk does exist as to off-gassing might happen, and inhalation from that will cause cancer going forward. Now, coming to the methods, here is the major breakdown of the methods for the study that we used. Our primary source of information, and it at times our only source of information, was the HPDs. As we all know, the HPDs have a plethora of chemical information, and they are actually, as we discovered moving forward with this research, me and my group mates, or who were actually helping me with this study, discovered that it's a gold mine for a lot of chemical information, from the mass to the hazard information, so on and so forth. So of course, that was pivotal to our study and the first step towards us understanding how formaldehyde might be actually embedded in these building materials in the different products that we analyze. The second portion was, as Wendy discussed in her introduction, was the development of novel computational framework for exposure assessment scenarios. Now let's get into the novel framework that I was able to work on during my doctoral studies at ASU. So the first portion of the novel framework was the product assessment. Of course, that was from the HPDs. What we did was we basically categorized these chemicals and found out the frequency of use and every other specific numbers that we could ascertain from the different products that we analyzed. We processed around 5,000 to 6,000 HPDs at that time when we did this research. And the next part from that was the mass estimations. So we took out the mass estimations from the HPDs, and then we used our computational methods to find out how much of a specific compound may be present inside a specific house. That's a typical US house. And then we discussed the exposure scenarios for these chemicals. As I said, in toxicology, there is no risk until there is exposure. So the exposure scenarios are very important for us in order to discuss the risk, as we'll see later on. Finally, we discussed the health effects of long-term exposure or chronic exposure to formaldehyde for occupants and how they might pan out in different scenarios. We created certain scenarios from the exposure scenarios that we discussed. We'll see that soon. And finally, we discovered tracking a method for the exposure to these chemicals, be it formaldehyde, be it phthalates, be it PFAS, whatever it might be. It will work for any one of those. But for this case study, we use formaldehyde just to go forward with that. So I'll quickly jump to the results of this study without any further ado. So this was the breakdown of formaldehyde and the mass balance of formaldehyde in the US from the year 2006 up till the year 2030. As we can see from the projections, like I discussed, so as you can see, the lower estimates in the world production of 2030, the formaldehyde production was around 60 million metric tons, while the upper estimates was more than 100 million metric tons. And that's an absurdly high amount of a carcinogen being produced freely. So that's a point of concern that we need to take from this and from this production in general. However, not all of that is produced in the US. But the US is still a major contributor to the entire formaldehyde that's being produced everywhere going forward. And this is what we discussed from this one. So the part B that you can see out here is the mass of formaldehyde, how we see, and the basic, I mean, there's a lot of data gaps. So we cannot really produce a mass balance without knowing all these data gaps. And therefore comes the issues of exposure and toxicology that we really could not answer till today before developing our framework, that is. So as you can see, these are the numbers for the mass of formaldehyde that might be present in the US at the time of speaking. That's around, this calculation was around 23, but it should be similar with 2024, given our error estimates should be aligning with that. Now, as you can see from the around 6 million metric tons of formaldehyde that was produced in the US, some 3.5 to 4.5 million metric tons of building material of formaldehyde was actually used in building materials. Now, again, that makes the building materials a big chunk of the user of the entire formaldehyde that's being produced all over the US. Actually, that's around 60% of the entire formaldehyde industry. That's pretty much the building materials that goes into the building materials going forward. Now, this brings us to the next portion of our results as to how the formaldehyde was actually distributed in the HPDC Open Standards Public Repository. We picked up those 6,000 odd products, and we analyzed them from the 6,000 HPDs that we had. And then we found out that desiccants had the highest probability of having formaldehyde in it. Around 20% of all the desiccants that we saw from the HPD, HPD public repository was that there was around 20% of the desiccants had formaldehyde in them, followed closely by the electronic components and dispersant. However, there is a little bit of contradiction to what we know from the literature. That is, it should be very heavy on the adhesives and insulators and binders. But again, this comes out as the reporting and how they're being reported specifically and the use of those chemicals in the certain cases. In spite of that, we did see some around appreciable numbers. If we added up the adhesives and the binders, we would see around 7.5 to 10% of the products having those things in them, having formaldehyde in them for that matter. Now, as we discussed, the formaldehyde was mostly present in woods, plastics, and composites. And that goes with the literature that is known already about formaldehyde being used in the building materials. Because as we discussed earlier, formaldehyde is mostly present in adhesives and binders. And processed wood, for that matter, as we all know, has a lot of these adhesives and polymers that's being used. The second most TSI division that we saw formaldehyde being present in was HVACs and openings, for that matter. And they also align with our understanding of how formaldehyde is distributed. And that gave us a good metric of what the distribution was, or generally the chemical demographic was for the formaldehyde in the different materials that we studied. The final graph that you see here is the mass fraction of formaldehyde. This basically tells us the percent mass as to how much of the entire product was formaldehyde actually in it. Now, the first part of our estimation, we were able to ascertain how much formaldehyde, the neat formaldehyde, might be present in a specific or a typical US house for that matter. And we were able to ascertain that around 240 at best, or close to 250 grams of formaldehyde might be present inside the house. However, this is the neat formaldehyde. If we are talking about the chemicals that contain formaldehyde in it, we'd be looking at around 48 to 50 kilograms of those chemicals being used, out of which this is the number of, this is the total mass of actual formaldehyde that would be present inside our house. And as you can see, the biggest contributor to the indoor formaldehyde present would be the pressed wood products, as we can see here as well. It's more than half of the entire mass that's inside it. And that goes well with our understandings and findings from what we have in the literature as well. Now, the next one, as we saw in our previous slide as well, thermal and moisture protection and insulations were always a big part of formaldehyde being present inside the houses, followed by HVAC and finishes like paints and other specific fittings that we found in certain scenarios that might also work. Now, moving on to the next scenario. So this is the exposure scenarios that I was discussing. So there has been a lot of scenarios in the past where people have actually gone over the threshold that you can see here. This is the threshold that was established by WHO for the long-term exposure of formaldehyde in living quarters, or for that matter, residential houses in this case. So as we can see here, this is the most well-studied formaldehyde exposure scenario from the FEMA trailers after Hurricane Katrina hit. And there was a lot of cases that were happening from a long-term exposure to formaldehyde, and there were people who were complaining about headaches. And it was understood that long-term exposure to those scenarios would actually lead to a lot of carcinogenesis going forward. But based on the scenario and the concentrations, the highest concentrations that were reported, we were able to ascertain the number of people who might be affected for just the year 2012 and 2022 and 2023. My apologies there. So as you can see, this number, the 645, give or take 33, is just for a couple of years. And if we keep on accumulating these will go up over and over again. Now, so many cancer cases, potential cancer cases as we might see, will lead to a lot of health effects as we see from here, and a lot of treatment costs. But it will also lead to around 17,000 of healthy life years lost for the entire population. And that comes to, if we just average it out for every affected individual out here, that would come to around 24 to 25 years lost in one person's life. And that's a significant chunk, given that we probably would live around 75, 80 years. That's a lot of years that we would be losing if someone were to be exposed to formaldehyde and get cancer, for that matter, through these things. And these are the different other scenarios that we found were most prominent and for the experience scenarios, as we discussed. And the associated treatment cost and the life years lost are also mentioned in the same thing. Now, coming to the conclusions, what we saw was formaldehyde is actually embedded in the building materials as we know it. And it might take up to around 4 years for the entire formaldehyde to be actually emanated out of the housing quarters. It would also lead to a lot of economic loss for the people who are affected, and also increase the patient economic burden for cancer in certain cases, as we saw here. And that's something that we really would like to avoid, not only for improving the quality of life for individuals, but also to enhance the economy going forward. Because again, one person who is working, if they're not working, they're also indirectly affecting the country's economy going forward. So that has to be taken into account when we do these things. However, the number that you see, the calculations that you see out here, the 65 million per year cost of treatment is just from the cancer treatment, and not from the other non-cancer effects that formaldehyde will actually cause before it causes cancer. It can cause headaches, it can cause migraines, and so many other different things. But unfortunately, there was no specific way for us to count those specific costs that might be associated with it, and the costs that would be associated with the hours and the years that were lost for the individuals who were affected. So we just stuck with the basic carcinogenesis analysis that we could find with the cost assessments there. But rest assured, it will always be more than 65 million if a scenario of that sort were to happen. Finally, concluding with the specific numbers as we discussed, around 5,700, from somewhere between 5,700 and 7,400 of formaldehyde was actually produced in, well, is estimated to be produced in the US. And out of those, somewhere between 3,700 and 4,800 metric tons, kilometric tons were actually used towards the production of building materials. As we discussed, around 207, give or take 40 grams of neat formaldehyde was present in a specific house, in a typical US house in the year 2022 and 2023 from our studies. And if that was to be extrapolated to the entire housing stock of the US, then that would lead us to around 30 kilometric tons of formaldehyde being present in all the houses that are a member of the US housing stocks. As we discussed, the desiccants were the most likely group to have formaldehyde in it, which would around lead to the absurdly high number of cancer cases that we can see, the treatment cost, and the additional life loss that we just discussed. Now, the final part. Now, as we discussed, this is the biggest development that we did for our assessment and what we have been working on. As Wendy discussed, so the lab that I used to work in specialized in a method called a wastewater-based epidemiology. That's nothing but assessing the wastewater of a specific region, or even a city for that matter. And then we assess it for the parent chemical that we're looking for here. It would be formaldehyde, and the urinary metabolite for that. Now, the impediment that we had till now was that there wasn't a known stable exposure marker, or a biomarker, as we would call it, for formaldehyde. The most known formaldehyde biomarker, or the most reported formaldehyde biomarker, has been that is formic acid. Now, our body typically produces formic acid on its own, whether there is exposure to formaldehyde or not. However, from our studies and from different other studies, a couple of other studies, we have identified a specific biomarker that's unique to formaldehyde exposure alone. There are a couple of sulfonated biomarkers that we were able to identify, and using those as biomarkers for exposure and metrics for exposure, we can ascertain these things going forward from these things. As you can see, the best way and the gold standard for measuring any exposure scenario is to go through the clinical testing route. But we know how difficult that can be, because we saw from COVID that testing a large population at times is difficult and even impossible, and it's impractical at best. So we cannot test the entire population just to see who is being exposed to formaldehyde and who's not. That's a cumbersome process, really, and not worth it in different ways. However, we can do it from a model-based approach, as we discussed in the previous slides. That, however, has a few issues with that, because they are very resource intense and they are very parameter dependent as well. As you can see in the second part of this this format out here, so there is a lot of parameters that would determine the final outcome in these scenarios. And given that we mostly have to work with scenarios that we do not really know much about, or do not have the necessary information about these parameters, often these models are biased in a different way. Not to say that they do not give us every good information. Of course they do, but they're always not very conclusive with the kind of effects, and typically we cannot get people to believe as to what kind of an effect it would be having, because it's not a tangible proof. So what my supervisor and I were able to enumerate out here was to go through the alternate pathway of wastewater-based epidemiology and measurement of concentration of metabolites from the exposure from the exposure that we are expecting for this to happen. And from the wastewater-based epidemiology studies, we can actually ascertain the kind of the exposure that people in general are having. Now, what does this also bring us? This is actually much cheaper than the clinical testing that we would be doing per individual. First up, it's a hell of a lot cheaper, but it still gives us enough information to go by, at least to focus our investigation in a specific scenario, if there was to be such a scenario in the first place. And going forward, this this strategy was actually implemented during COVID, and it paid dividends with the kind of work that we were able to do to beat the pandemic and move forward from there by focusing specific testing in certain scenarios and moving forward from there. So our lab was one of the pioneers who came up with this technique to measure this, and we believe that such a technique would also be prevalent in measuring exposure for this specific scenario. Finally, I just wanted to discuss a little bit as to how we do the wastewater study out here. It's typically broken down into, this is the city of Tempe that I'm just located in and we work mostly with. And we were able to break the city of Tempe in different locations, almost 9 locations, as we see here, 9 regions where we broke down the analysis. And once we have the exposure parameters and the biomarkers from these locations, we can pinpoint and find out how much of exposures we are seeing in certain locations, certain areas, and then we can drill down further to understand, find out paperwork like HPDs, EPDs, and any other the building materials going forward. So it's basically the mass loading per population that we can work with. We measure the parent chemicals and the urinary metabolites, the wastewater sample that is collected, basically give us all these information. And we can find out with certainty as to if people are being exposed to formaldehyde or any other chemical for that matter, be it PFAS, formaldehyde, or any of the chemicals that we would like to look forward towards. Finally, the study was actually published in this journal Science of the Total Environment. And for anybody who is interested to read up further more about this, I can share the link to that, and we can share the paper with the interested party. That brings me to the end of my presentation. Thank you for your time, and it's been a pleasure on my end.